Let's spend a moment and let's talk about some questions that have come up. First question is, what is the best way to approach arthritis deep in joints, like hip and knee pain? Never tried a transdermal. You've kind of triggered something for me because I have had 3 knee replacement operations, and that's about as deep as it gets. And I can tell you, the question is, what's the best approach? You want to take and use a product that you feel comfortable using. Some people are comfortable with tinctures, some people aren't. Some people are comfortable smoking, and some people aren't. Do something that you're comfortable with. I know I'm not a fan of carcinogens and burning flower, but I really do like vaping because the steam process gets rid of a lot of the negatives related to flower, and it does give me almost instant relief. So really, when it talks about what's the best approach, I think it really talks about which products you're comfortable with. And then again, I think the second thing is matching that to the terpenes, which I think, Michael, as a person who's worked in the dispensary and as a bud tender, you can be able to take that profile of those terpenes and really match products to the customer's need.
And this is correct, Mark. As you said, it's important to start where you're comfortable with your products, but there are multiple different ways that you can medicate and get the benefits you want according to what you prefer and what you're comfortable with, as well as matching those specific terpenes to the products you're choosing.
Mhm.
For somebody starting out, possibly with the patches, I would recommend, your topicals. If you haven't tried those, if you haven't tried one with CBD and THC, the one-to-ones, they not only help with the pain, but they're going to help with inflammation or swelling. We also have edibles you can start low dosing with those. We have mints, we have gummies you can cut in half or quarter. And of course, as Mark said, there is smoking. Some people prefer to smoke. Just remember to start low, wait a few minutes. If you don't feel anything, take another inhalation and wait your, 2 to 4 minutes just to get the effect. And then, of course, we have concentrates, we have capsules, we have RSO. So there's a wide variety to
You've
get the
got
relief you want.
you got a lot of options. And so let me just cut right to the chase here. What I typically do is when I wake up in the morning, I can be at a pain level of a 7 or an 8. So what I do is I first of all grab a vape pen and take 1 or 2 hits off of the vape pen, because if you look at the profile of the vape products, they work almost immediately. And literally within a minute or two, my pain goes away. And it takes it from a level of 7 or 8 down to a 1. The first time I did it, I was shocked. Even this morning when I did it, which is really almost 6 years later, I still am shocked at how fast it worked and how well it worked. I then follow up almost immediately with a tincture drop. I take about 3/4 of an eyedropper of that. And what that does is it takes about 20 minutes to 30 minutes to work for me, and it'll work for 4 to 6 hours. So that's basically giving me pain relief right away so I can start my day. Gives me a product that'll take me into the early afternoon. And then depending on my schedule, I'll either use a gummy or another tincture drop in the afternoon, because I have a situation where my pain isn't going to go away. This isn't something where, when you have herniated discs in my neck, it's always going to be there. So I have to do something almost all day long, or I will get my pain back. So I'm typically looking at gummies, or I'm typically looking at tincture drops in the afternoon. And then early evening, right after dinner, what I'm doing is going back to the tincture drops to carry me into the evening hours. Now, what I do before bed is I'm a chocoholic. I usually an hour or two before I decide I want to go to sleep, I'll usually use a chocolate, or I actually make my own. What I call it, my wife calls them magic brownies. So I'm making my own brownies with cannabis in there, and that takes about an hour to an hour and a half to work. But that, because it works for 10 hours, I'm able to get a good night's sleep and not have to wake up at 2 in the morning like with a tincture drop. If I did that, I'd wake up at 2 in the morning, with about 4 hours after it wears out, and I got to do it all again. This gives me the capability of sleeping through the night. So the best way to do it is to put together a regime, mixing and matching, that really matches that what you're comfortable with, and then being able to candidly stick to it and work. Now, one other thing I'm going to point out: cannabis works with the phytocannabinoids, work with the endocannabinoids in your body. It's important every 4 to 6 weeks to take what they call a holiday. Take 1 to 4 days off. They recommend taking 4 days off, because what it does is, by not using any cannabis for 1 to 4 days, your body says, well, wait a minute, I'm not getting the cannabinoids from the outside. I have to produce them myself. kind of recharges and get your body back into working again and working better. It's not going to rely on something from the outside. What you'll find out is after you finish your holiday, your body will work a lot better. You'll use less cannabis and get more relief, more products that are there. Now, I do want to point out that while you're doing that, in my case, because of the herniated discs in my neck, I can only go about a day, maybe a day and a half, and then my neck taps my shoulder and says, "You better do something pretty quick, or you're going to know I'm here." So again, it's all individualized. Every person is different. Just like alcohol and caffeine, you'll find that everybody has a different tolerance. But really dialing that in, it only takes about a week or two to really dial that in. Can you smoke recreational weed while you're on medical marijuana? Well, you can smoke cannabis anytime you want. Again, recreation, the definition of a recreational product is something that you just want to go in, you just want to use it to chill out, enjoy, and relax. Okay, in many cases. So the answer is yes, you can. However, it could get in the way of your medical marijuana, and that's what's important. First, concentrate on using medical marijuana. In many cases, when you use medical marijuana, you won't get high. You won't get that euphoric effect. You'll get a little bit. You'll feel a little bit of the relief coming into play. But again, it's a different process. You're trying to control your pain or control your inflammation. Again, you can use both of them, but I say pay attention to the medical marijuana. And sometimes when you use recreational marijuana, it may get in the way of your medical marijuana, and that's something you may not want to play with. Michael, your thoughts on this?
And I do have one thing I want to highlight on that. As you said, Mark, you can use recreational, but I personally don't encourage it. Not only is this, dangerous how you're getting it, but you don't know anything about where that marijuana is coming from. You don't know the strains, if there's anything else in it. So I always recommend getting your products from a dispensary. It's medical marijuana. It's geared. You know what you're getting. You can look at the terpenes for your specific arthritis relief and benefits, and it's just a way more trustworthy source.
And that's really, really important. The thing about Florida licensed dispensaries is the product's safe, and that's really, really one of the keys that's out there. Now, again, your use of cannabis is totally up to you. One of the nice parts about using medical cannabis is that you are in control of what you're doing. You can use it recreationally, you can use it medically, but I think if you're looking at it from a medical standpoint, my goal is to really get the relief I need to reduce the pain and the inflammation. Once I get that done, then I'll worry about the recreational side. And usually by that time, I'm happy where I'm at. But again, every person is different, and please feel free to use it as you want to. Next question that is on this list here is, please differentiate cannabis use for osteoarthritis as well as RA, rheumatoid arthritis. Really, it's not really that much different. It's the same product, the same terpenes, the same routes of administration. It works because even though the arthritis is brought into your body and the situation's been created by two different environments, the relief that comes into place is coming from the same products that are really out there. So there really isn't any differentiation. Again, find a route of administration that you like. Make sure you have the right terpene profile, and then, of course, maybe dial in that route of administration. Excuse me, dial in that therapeutic dosing level that really helps you. Your thoughts on that, Mike?
And I would just maybe encourage to try THC products that have CBD with them.
Mm-hmm.
That way you're getting the pain relief and inflammation, swelling, and the combination of the two.
That's an excellent point, because by reducing the inflammation, you're reducing the pain. And I know a lot of people have said, well, CBD is great for reducing pain. And really, it's okay for reducing pain, but it's not great. What it does do is great for reducing inflammation. And in many cases, when you reduce the inflammation, it does reduce the pain. So that's where it really, really comes into play. And it's a good comment, Michael, is making sure that we have the right combination in play that's really there. Next question is, I missed the seminar on neuropathy. How can I get info at this point? Please go to YouTube, go to the Marijuana Aware YouTube channel, and you'll find the neuropathy video out there. You'll find both the video and also the Q&A that went with the video on that. And by the way, not only the neuropathy videos out there, but all the videos we do on Marijuana Aware that are out there. Plus, we do a number of snippets, which are just short videos to really help you understand more about medical cannabis. Next question is, how do you use marijuana and not get the munchies and gain weight? That is an excellent question. When you use cannabis, what it does cause your body to relax. In many cases, when your body relaxes, you do get, what they call the munchies. I think the issue really becomes to control the munchies or to get the munchies and stick with the healthy side, the carrots and that kind of stuff. Although uh, the brownies and that kind of stuff really come into play, really is where you're at. I think the real point is you do get the munchies, and I think the issue is really use the right products, use the right munchies that are really going to help you, and really use some constraint on that. Your thoughts, Michael?
And you're exactly right. I've patients experience it all the time. I've experienced it. I think it exactly what you said. You get more relaxed, so you're not as focused on that type of stuff. But there are ways that you can sometimes avoid munchies and weight gain. There are different strains. You have your sativas, which give you a little more energy. They can give you pain relief, but they're not as sedative. They don't make you as hungry. So they are good for people who don't want to gain any weight. And then, of course, your indicas, some of your hybrids, those tend to give you a little bit more of the munchies. Those are your anti-anxiety, your relaxants, help with sleep and stuff like that.
Now, the next question is: I used to have to an RX subscription of 800 milligrams of ibuprofen. That's a lot, but after bariatric surgery, I can no longer take NSAIDs. Can I take cannabis? The answer is yes, and absolutely. Many people who've gone through the pharma drug versions of pain relief have really come to medical cannabis for two reasons. Number one is it works more effectively than the pharma drugs. Number two is there's no chance of being addicted to it, and there's no chance of dying from it. And those are really, really keys that are there. I have a number of patients that I've worked with in the past that have gone from ibuprofen to cannabis. In fact, other insets that are out there, we've really taken a look at that, and they found it works very well. Now, how do I know cannabis works better than pharma drugs? When I had my left knee replaced, I was working with a well-known orthopedic surgical group called Jewett Orthopedic here in Orlando, and I didn't want to use. I wanted to use medical cannabis for pain relief and not the pharma drugs. And they were very happy to accommodate me. In fact, we set up a test where I used medical cannabis, and they had 4 patients that used pharma drugs. We were operated on Monday. We got out of the hospital on Wednesday. I did in the hospital take ibuprofen. I took Percocet. I wasn't allowed to do medical cannabis in the hospital. But on that Wednesday, what I did when I got out of the hospital was I basically literally did not take any pain pills that morning. Got out around noon. My wife drove me into she was driving. She took me into the garage. I had a vape pen and did some tincture drops. And literally by the time we got to the street, got out of the garage to the street, my pain level had gone from literally almost a 9 or a 10 down to a 1. And I kept it that way through the whole experiment. Now I checked in. We had two to three meetings a week with our group of 5. Here's what came out of that. After 2 weeks, one of the other patients went to medical cannabis versus the Percocets that they were giving out. The other 2 patients actually did get some pain relief, but not the same pain relief, not to the level that we did. We had a much better, let's say it was a much better outcome using cannabis. One patient dropped out altogether from that particular study. And literally at the end of the study, 3 of the 4 patients that were still in it were using cannabis. So it's a matter of, I've actually gone through and experienced it. I've seen it work. And again, there's no negative side effects. It's not like opioids. You can't get it. You can't get physically addicted. You can't get. You're not going to die from it. Nobody's ever died from using cannabis, either recreationally or medically. So this is something. The answer to your question is yes. I'd highly recommend it. And please talk to your medical cannabis practitioner or your medical cannabis doctor. They'll help you get started. And also, when you go into the dispensary, like Michael's dispensary at Air, they'll coach you and they'll counsel. You can get a consultation where you'll work with Michael. You'll work with the patients and what products will really work best for them. Is that correct?
And that is correct. All of us at Air, we want to give you the best knowledge for your products. We take time with our patients to explain the whole process. We have a lot of new patients and patients that are just starting out. So we want to pay we want to provide as much information for you guys that we can. And one thing I did want to add, as NSAIDs can be harmful to your liver, THC is not. So that's one thing I like to look at.
That's a good point. Let's run on to the next set of questions that are here. What is the best for severe pain, and what is best for inflammation? Well, this is kind of interesting question because best, first of all, I want to make sure people understand cannabis is very personalized, like tobacco, I'm sorry, like alcohol and like caffeine. Every person has a different tolerance level for it. I know I have friends who, from a standpoint of alcohol, some friends that have one drink, they're done for the night, and I have other friends that drink the whole bottle and they're just getting started. The same thing happens with cannabis. And so, what you have to do is when you first start, go low, go slow, find out what your tolerance level is for THC. That's that therapeutic dosing level. I'm going to throw a shameless plug to go out to our YouTube channel and watch some of our dosing videos. They'll help you figure out how to do that correctly. But once you find out what works there, then it's a question of what terpenes work the best. And so when you ask what's best for severe pain, I have found caryophyllene, no question. Make sure that the product has a higher concentration of caryophyllene and myrcene that's there. And then if you want to have some energy in the afternoon, you have limonene, or you can use linalool in the evenings to get the sedative effect. I do want to point out that pinene is a good product to help with pain and inflammation. However, pinene also has the capability of bringing back short-term memory. And if you suffer from PTS or PTSD, the product you may want to stay away from. You just don't want to poke the bear. You don't want to get into an area where you may have some particular problems that are there. I think those are kind of, I recommend that terpene profile. And then, of course, the route of administration that you're comfortable using. That's how I recommend that you approach it. Your thoughts, Michael?
This is just an adamant tool to finding products catered to what the relief you want. And this is something you can look at. You can go into the dispensary. You can ask your bud tenders, your patient advocates, the type of terpenes in the strains and in the products, or as well, they're listed on our website. So this is an adamant tool where you can look at and pick those products really dialed in towards what you're wanting and get the best benefits out of your product.
Great. Really helps. Let's jump into the next question, which is, I use CBD and CBG for arthritis. How do I know what ratio is good for me? Well, again, this goes back to you're experimenting with it. Trying different ratios is something that's really, really important. I think, Michael, your thoughts on this, because you run into this quite a bit when you're in the dispensary, right?
So I think so ratios are different for everyone. A lot of this is, if you're doing a tincture or from whether it be tinctures, edibles, capsules, the ratio products each one of us are different. So every patient's different according to what dose works for them. Mostly it's a trial and error period, and you make a journal, you track what works. If it's relieving the pain, you may have to take more, you may have to take a little less. So it's really just about trying new things, trying different methods, and then keeping track of it and what's working and what doesn't work for you.
That's good advice. So the answer is yes, you can. And again, I would say go low and go slow and experiment with the ratio, but I would start out with a ratio of 1-to-1, and then I'd experiment by increasing the amount of CBD, okay, and see if that really helps. And if that doesn't, then increase the amount of CBG and reduce the amount of CBG that's there. But really find out what your body is really tuned to. I can't give you a definitive answer because I just want to make sure you fine tune it, and it's easier for you to do. You're in control. Next question is one that I love. Please cover RSO as a treatment. I am a huge, huge fan of Rick Simpson oil. RSO is called Rick Simpson oil. It also has a name of what they call FSO. You'll find that in the market. That's full spectrum oil. Now, what's the difference? When Rick made the product literally 25 years ago, he was using a cutting agent. Then what they found out is there's better cutting agents in the market today, literally 25 years from now. And so when they're using it, it's just a better cutting agent to make the RSO product. But it is RSO, and it does have all the components. The main component is it's full whole plant. They take the whole plant and they make a product out of it, which means all the cannabinoids are in it, all the terpenes are in there, and all the flavonoids are in there. So it's very, very, let's just say it's very, very powerful. That's the good news. It's also the bad news because it's also very, very powerful. RSO, I consider RSO to be the 151 Bacardi of the cannabis world. It is strong. And so go low and go slow. If you're using it in a syringe format, you can actually take it and just squeeze out a little bit of it, about the size of maybe about the size of about a half a grain of rice to start with. Then maybe a grain of rice, put it on a cracker, put it on chocolate, put it on cookies. It works really great. Also, RSO comes in other forms besides the syringe. It comes in a capsule, for example. And Michael, I'm a huge fan of your capsules. What do you think about those things?
And the capsules, as well as RSO syringes, we have RSO tinctures. Those are all products that are all highly sought after at Air, and they all provide really good, really good pain relief
Mm.
benefits. So, there's lots of options. I'm a firm believer of it. Um, at times we may not carry capsules. Patients will get empty capsules on Amazon and fill them with the RSO syringes and make their own dosing. We
Mhm.
have some patients that will put it on little half of rice grain amounts on wax paper and freeze it, and then they just swallow it. It does tend to be sticky. So you can put it on like a piece of candy, a piece of fruit or something like that. Just
Mhm.
keep in mind it may get on your teeth a little bit, but it's as Mark said, it's best to start low. It is pretty potent, so you start low, and if you need to take more, you do it that way after you
Sure.
wait.
But I have to tell you, I'm a huge fan of it. It works great. With my pain and inflammation, I think it's probably the best product for my pain and inflammation that I've found, at least for me. That's my humble opinion. Let's jump into the next question, which is, does medical marijuana help with asthma? And interestingly enough, a study was just done out of Israel that showed that it does. Now, it has a different terpene profile than you'd find, for example, with arthritis. That you tend to find, when you're looking at asthma, they have a little bit more of the eucalyptol product that's in there. They have a little bit more of the terpenoline product that's in there that helps with the asthma that's there. So when that chart, we had that chart of terpenes. You'll get it in when you get the email as a follow up to this. Take a look at what you want to do is you want to take a look at the line, okay, that has to do with the different conditions that you have. It'll tell you the terpene profile that's out there. What you'll find out is, again, with asthma, the eucalyptol and the terpenoline really helps quite a bit that's there. Your thoughts on that, Michael?
And I might just add, for if you're somebody that has asthma, you most likely would want to take a look at that, because you don't want to go getting something that is going to exacerbate that or make it any worse. And of course, if of course, you're probably staying away from smoking, but just in case, I would recommend checking the terpene list, looking at your products and seeing products that have terpenes that will help alleviate the asthma
Sure. Great.
and relieve the asthma.
Great. So let's jump to the next question. Michael, this is one that you're going to really enjoy answering. Are topicals recommended for muscle pain? We talked about this prior to the webinar.
So, Mark, yes, I would recommend topicals, arthritis pain, muscle pain, whether it's chronic, acute. The topicals are going to help, not only help with the pain, they help with the inflammation, swelling. Now, I have hurt my neck before, and like to the point, like I couldn't even turn. I used some of our balm, our THC, the CBD and THC 1-to-1 balm. It
Mhm.
coasted me through a full 8-hour shift of work.
Yeah.
It has a cooling effect. And it really works well for patients with any type of cramping pain. I've even heard of patients, of women using it for their cramps during their
Sure.
menstrual cycle and stuff.
Sure. Good point. Good point. So the balm is what you have. You have a balm. You can get that at Air. The balms work really great. And there are some transdermal topicals out on the market that you can also find that can really help quite a bit as well. Let's jump to the next one, which I again, some of these questions I really like. What ingredients and supplies do you use to make your own brownies? I live on a small income at 83 years old. Um, First of all, brownies work great, but remember, it takes about an hour, maybe 2 hours to work. Now, here's what I do. I call them the poor man's brownies. I go to Costco and I buy the Ghirardelli chocolate brownie mix. I like the fudge chocolate brownie mix. You can get a nice, I think there's 4 packages that come together at a great price. Then when I come home, what I do is I tend to get and I use flour, and I take 7 milligrams of flour ground up. I grind it just a touch more, just to be able to make sure it has some consistency with it. Although a lot of people recommend not grinding it after you use it, it just depends on how you want it. You experiment it as to what works for you. And what I want to do is I then mix that in the brownie mix. Now, key to this is when you're making your own brownies, stir it very, very well. Make sure you get that if you're using flour, make sure you get it thoroughly throughout the batter that's out there. Now, Nurse Amy, who does a lot of the videos with me, also she likes to use the syringes. She uses the RSO syringes, and she'll just squeeze the whole syringe into the brownie mix. Or you could try. I probably recommend trying half a syringe first before you do that. But she puts a whole syringe in, and again, she makes sure it's mixed very, very well, because you don't want to have a brownie where part of the brownie just is saturated with cannabis and the other part has nothing in it at all, and you mix it up very, very, very well. So that's kind of the process that I use. And what I do is I take the brownies usually about an hour or two before I go to bed, and it helps me sleep through the night, and it works really, really great. And when you talk about it from a cost standpoint, it's extremely cost effective. I mean, I find making my own is something that gives me a tremendous product in the evening. And again, it's the cost of a Ghirardelli box of chocolate brownie mix from Costco, and the actual ground up flour itself. Michael, do you have any magic formulas that you use for making brownies or anything
So
else?
I'm along the lines. I'm plain Jane, simple, straight to the point. I'm like Nurse Amy. I use syringes, I use RSO and distillate syringes.
Mhm.
What I have found the best way to make my edibles, if I'm making brownies, cookies, any type of baked good, I just get I'm pretty lazy and simple. I just get a box of mix. I make sure to infuse the RSO or the distillate into whether it be the butter or the vegetable oil, is what I recommend, just to get an even dosing. And
Sure.
usually, how you can do this is just by heating it up a few seconds in the microwave. And then,
Mhm.
as Mark said, mix your oil or your soft butter really well, and then mix it into your mix and stir it really well. That way, your dosing is consistent.
Right. Now, one of the things that's key about making brownies is there's a process called decarboxylation. What is that? That's where you take the flour, not the RSO syringe, but you take the flour. And when you take it and you take it out of the box and you grind it up, what you do is you then heat it in the oven at 240 degrees for approximately 35 to 40 minutes. What you're doing is you're activating. Remember, we had that chart that showed you all the cannabinoids and showed you all the terpenes. What you're doing is you're taking that product, and you're activating the cannabinoids, and you're activating the terpenes, and you're taking the cannabis to that level that really lets you dial in the relief that you need. So that when you take the cannabis product and you drop it into the brownies and you cook it at 350 degrees, you don't overcook or you don't eliminate any of the cannabinoids or the terpenes that are out there. You can take the product by itself and just drop it into the brownies and cook it without decarboxylation, but you may burn off some of the cannabinoids and some of the terpenes to do that. So decarboxylation is something that's really important that's out there. By the way, if you take a look at, we have a video out there as part of when you go to the YouTube channel, there's a video on your cannabis journey. One of them is on edibles. You might want to take a look at that video. It goes through how to make, how to make brownies and really how effectively to use cannabis as an edible. Final thoughts on that, Michael?
I just I like to, as you talked about, I like to look at the terpene toolbox and the different heat settings and stuff and look at the terpene activation heat. That way I'm making sure I'm not burning any of the terpenes off, but I'm also reaching the right temperature to activate them.
Right, right. So let's jump into some other questions that are out there. I know we have the questions that have been asked during the webinar. We might have some pre-submitted questions. There are. Okay. What is the most effective products for me to manage arthritic pain, especially in my hands and my wrists? Um, I have, again, it depends on what you're comfortable with. I have found that two products that work great. First, the topicals. Topicals work almost immediately, and for hands and for wrists, there's something that's really good. I'm getting a little bit of arthritis in my hands. Again, welcome to being a senior citizen, and I use the balms, use the balms quite a bit to really help me through that. The other is you may want to take a look at some tincture drops that really help you dial in the terpene profile that you're looking for. That can help you quite a bit. Your thoughts on this, Michael?
The I recommend both the things you just mentioned, and I will add on the tinctures, they are pretty fast acting compared to our some other edibles.
Mhm.
So they can kick in, anywhere from 15 minutes to 2 hours. Most of the time they kick in before the 2 hours. I just like to be played on the safe side,
Sure.
but those are really effective. The If you are experienced and you do have a lot of pain, RSO, in small
Yes.
amounts, whether it be capsules or the syringe. But those are some of the best forms of
And personally, I prefer the RSO capsules because they work. They do give you that 6 to 10 hours of relief. Do take a while to work, but they're very, very effective. That's out there. So again, it just depends on your particular style and what you really like that's out there. Michael, let's jump into some of the live questions that we got during the webinar itself. Yvonne asked a really good question. Will the medical marijuana practitioner explain the best strains and dosages for arthritis? Well, there's two ways of answering that question. First of all, a lot of the doctors and a lot of the clinics you go to get your card will give you a recommendation. They'll actually say, we recommend you using these types of products. They'll recommend the tinctures, the edibles, the flower. They'll work with you on what types to use. It's not like a prescription that you get from a doctor that says, take 2 pills and call me in the morning. What they're doing is they're saying, use the best route of administration, and then you yourself go low and go slow to find the route of administration that's best for you and the therapeutic dosing level. Now, you might say that that's a little tough because you're doing it yourself. However, in my talking with doctors, when they say 2 pills, take 2 pills and call me in the morning, what they're really doing is they're giving you the basic minimum that they think will work. And most of the time, 90% of the time, it doesn't work. So you got to call the doctor back. You got to get the practitioner online. You got to set up another visit. You got to set or do a telemedicine visit. You've got to you got to go through this whole process to really change your medication into up and down it. With medical cannabis, you can just go from a quarter of an eyedropper to a half an eyedropper. You're in control of that, and you can actually back down if you're beginning to not feel the comfort and the relief that's really there. So the answer is a medical cannabis practitioner should walk you through that. However, don't be upset if you go to a doctor's and get your card and they don't cover that because they're not required to cover it. In many cases, they're really worried from the standpoint of the legal aspects, whether it's something they can really prescribe or not, because they don't allow, Florida doesn't allow doctors to give prescriptions. Medical cannabis practitioners can, but not the doctors. Your thoughts on that, Michael?
And you're exactly right. It's really depends on the provider. I've seen providers, that don't really give patients many information, or there's been physicians that are educated, they know all about the medical marijuana. They've given specifics for patients to try according to their symptom relief. But this is where if a doctor doesn't give you all the information, you're not out of luck. This is where you go to your dispensary and you ask your workers and your bud tenders, your advocates to help you with this. and you take the advice given, but also you start slow, you try new things where you're comfortable, and you develop your own plan for what works for you rather than just going off of what a lot of the doctors do is just give you a generic dosing and things to try.
Right. So the answer is, what are the best strains? I don't usually talk about strains. Strains are actually now called cultivars. What are cultivars? Cultivars are the cannabinoids and the terpenes and flavonoids that are targeted for a particular condition, like arthritis. Strains are just, basically cannabinoids, cannabis that's been grown out there with different terpene profiles. Now, um, would you say the best? I recommend RSO, but again, I would also take a look at your topicals, and I'd also take a look at your edibles, as well as the tinctures that are really out there. Let's jump to the second question, which I think is really, really a good one. Uh, can I recommend a quality vape pen that offers temperature control? Well, I'm going to answer this from two different perspectives. First of all, if you're looking for a very, very cost-effective product that does that, I believe that you can walk into most dispensaries, including Air, and buy a vape pen that has a high, low, and medium setting. Is that right, Michael?
That is correct. And, there are so many products on the market. I will say you pay for what you get, as in everything in
Mhm.
today's age. But there's so many good batteries out there. There's the Ooze, there's Blazy Susan. Air has several just $10 batteries that have the 3 heat settings for you to set on them.
Yeah, and by the way, they work fine. Don't be taken back by the cost. They work great. So pay attention. And by the way, one of the things that's going to get tariffs thrown on it is going to be the vape pens. Those $10 vape pens, maybe $15 next by the end of the summer. But still, it's a very cost effective solution. I do want to point out, I personally use a device called Lynx. It's Lynx. It's made by a company called Onyx. It gives me 4 temperature settings, which I think is great. It also has a dab setting, which I think is really, really good. And it's easy to use, very comfortable. But the problem is that particular pen is more like a $70, $80 pen as opposed to a $10 or $20 pen. So it just depends on, like Michael said, the quality of product that you really want to take a look at. I'm a big fan of the Lynx Onyx products. I think they work great. Your thoughts on that, Michael?
Yeah, just it's all what you're wanting to spend. They all do. I don't have that type of product, but I am, as you discussed with me, that is something I want to explore. I'm a smoker. I've previously been a flower smoker, but I've been burning off a lot of the benefits of my terpenes because of its at the highest heat. I would like to dial in a little more and accommodate my dosing for my symptoms.
Right. That's really there. That's a good point. So let's jump off to the next question. Stu asked a great question. Further question: can both cannabis and ibuprofen be taken at the same time? The answer is yes, it can. Cannabis really doesn't interact or doesn't get in the way of ibuprofen, and vice versa. However, you're kind of attacking the same receptors and trying to do the same thing. So I would say I probably back down on the amount of ibuprofen that you're using over time. After a week or two, I probably get off of the ibuprofen. But the answer to your question is you can use both of them at the same time. Your thoughts on that, Michael?
Well, and if you're using both, you're not really going to be able to see if the cannabis is helping or
Right.
which, if it's benefiting you anymore. You're still taking the ibuprofen. So as Mark said, I would back that off a little bit just to see how to better evaluate your terpenes, your cannabis profile, and the method that's working better for you.
Yeah. And I should point out, ibuprofen is not good for your liver and your spleen. It can actually, after about 2 weeks, can start damaging it. So cannabis does not. That's why a lot of people really want you to really look at cannabis as opposed to some of the pharma drugs, because of the lack of negative effects on your body that's really out there. And that's why I recommend getting off ibuprofen. But can you use them both together? The answer is yes. You won't really have a complication other than the fact that it's hard to tell which one's working. cannabis will work more effectively than ibuprofen. And there's a lot of studies out there. By a lot of studies, I've seen 5 studies on this particular subject matter that really covers that particular case in depth. So I hope that answers that question for you. Dawn has a great question. It's an RX question. She says the RX question was mine. It ended with, what type of THC do you recommend? Not if I can take it, I already do. Now, here's my key here. I wouldn't worry about cannabis, CBD, and THC. I wouldn't worry about really the strains. I'd pay attention to the terpene profiles. The terpene profiles are which gives you the medical benefits. The cannabinoids, think about the cannabinoids like Lego sets. Each of your receptors has a different shape and a size. The cannabinoids find the receptor that binds and fits their particular shape and size and bonds to it. And when it bonds to it, it then introduces the terpenes, flavonoids into that particular receptor. That's why certain cannabinoids work better with certain receptors versus others, because of the shape of the receptors that are really, really, really out there. So the answer to your question is, pay attention to the terpenes. I would not necessarily work that much. When you say THC, it's kind of a nebulous term. Get the right terpene profile, find yourself a 1-to-1 ratio, and then really work from there. You'll probably find, especially with arthritis, by increasing the amount of CBD, meaning going to a 4-to-1, meaning 4 CBD to 1 THC, or even 20-to-1 CBD to THC, it'll work much better, because you're relieving the inflammation, which is the main problem with causing pain in arthritis. Your thoughts on that, Michael?
I'm right aligned with you, Mark. I say don't necessarily focus so much on the type of THC or the strain. The best way is to look at the terpene profiles. You can ask your dispensary workers. You can go online and look. It lists all that information. We have this certificate of analysis that you can scan or open up on the website, and it really breaks down percentages of those terpenes in your products, so you can look for the ones to give you which benefits you want. And like I said, so many patients, they just want to try, either the highest THC or just try something because of a name. And that's, if you're looking for specific symptom relief, you'll want to look at the terpene profile.
Sure. There. Let's run to the next question. Pam has a good question. Are you grinding dry flour by itself? And do you decarboxylate your flour before baking in the brownies? The answer is yes. Well, first of all, sometimes I will buy ground flour. Okay. Get the lazy man, but typically I buy flour and I grind it myself. And that's because I can control the how finely I grind it. I don't grind it real fine. I keep it kind of a medium to fine grind that's there. That's really the best way for it to work with the brownies itself. And every time I decarboxylate it. The reason I do that is because what you're doing by decarboxylating is you're preserving the terpenes in the flour itself, so that when you put it in the brownies and you bake it in the brownies at a higher heat, it doesn't get rid of a lot of the terpenes. They're already converted and they're already there. So the answer to your question, in both cases, I do grind myself and I do decarboxylate every time, and it works really well for me. Michael, your thoughts on this? Do you grind and decarboxylate?
Not in particular. I was gonna let you take away that one.
You're an RSO syringe guy, so you
I
can
am
decarboxylate anything.
RSO and distillates. I've had lots of patients tell me how to do that, and have lots of patients that prefer that method. I've just never experienced it, and that may be more of I may waste my product more than get the benefits out of it doing it that way. I'm the cheater. I'll go the cheater way and mix it into my vegetable oil.
But no, the answer to your question is yes, I do. I grind it myself and I decarboxylate, and it works fine. Does it take a little more time? Yeah. How much time does it really take? Probably about 15 minutes. It's not like I'm in the kitchen for 4 hours. But I also, for me, there's a therapy. There's a therapeutic aspect of this. I kind of enjoy grinding up the flour. I enjoy the smell of it. I enjoy doing that. The decarboxylation actually gives a really nice smell throughout the house. Even my wife likes it, which I find very interesting. So it's something that I kind of find very therapeutic, that whole process that's there. See, we had a couple other questions that came into play. I think Ron had a question. What is the best strain for PTSD and arthritis? I like a little bit of CBD, as well as right now I'm using a blueberry skunk. Now, blueberry skunk, I don't know that particular terpene profile of that product, but I will say this: the best terpenes for PTS also match very closely to the terpenes for arthritis, and that goes back to caryophyllene, myrcene. Again, linalool will elevate your mood, so use it during the day. If not, use a product that has limonene in it in the evenings to be able to calm you down. And of course, you'll find a minor terpenes in these products are terpenoline and boronol. Your thoughts, Michael?
No, I'm aligned with you. I would just make sure I stayed away. I can't remember which particular one you said, but I would stay away from the one that brings back memories because for PTSD.
Yeah, that's pinene, and I would stay
Pinene.
away from pinene. Pinene will bring back some short-term memories, and what I just don't want to poke the bear. That's all. I think what you're trying to do is you're not trying to suppress them, but you just don't want to bring them back up unless you have to. So
Exactly.
I think
We
that's something
want
there.
to keep everybody calm, help the pain relief.
Mhm.
Um, and if you stay away from that, it's less likely to even have that risk of happening.
Right. And CBD, by the way, acts as a great super vitamin. Not only does it work with a CB2 receptor, it works with 7 or 8 other receptors in your body outside of the endocannabinoid system to help with your blood pressure. It helps with not only pain, it helps with inflammation. There's a lot of different things that it does. So yeah, the answer is don't shy away from CBD. It's something that can help you really quite a bit. Um, let's ask the question. I think Gene asked the question. It says, am I losing terpenes? Let's see. Am I losing terpenes if I bean crush my flour and directly put it into the brownie mix without decarboxylating it? Um, the answer to your question is what I brought up before. The reason I decarboxylate is because I can freeze, in essence, freeze the terpene mix of the product that I'm putting in. When you just put it in directly, you're subjecting it to, depending on the temperature, that 375 potential to 400 degrees that are out there. If you get over 350, you start burning off some of these terpenes over here, especially in some of the cannabinoids that are here. That's why I go with 356. When I make my brownies, I cook them at 350, just to give you an idea. That's really there. So I do it basically because I found it to be effective, and I can kind of lock in the terpene profile that I want. But you can probably put it directly into the brownie mix. I've never done that. Let's put it that way. So I really can't give it the authoritatively that it works. But you can probably do that, and really, you're going to be, as long as you stick to 350 and don't cook it up at 400 degrees, you'll probably be doing okay. Your thoughts on it, Michael?
The only thing I would suggest, I don't know how well the texture is if you just dropped it in uh the batter. Oh, I guess you're crushing it up, but I would probably, from my experience, I would probably decarb it
Right.
and before I put it into the mix.
Yeah, and when you talk about bean crushing, I'm assuming that you're using like a coffee grinder kind of thing, and they work very effectively. And you do not have to have a fine grind on your flour when you put it into brownies. In fact, they don't recommend it. Sherry Cannabis, who I've talked to many times about how to make brownies, she's probably one of the best cooks, and she has a website, sherrycannabis.com, for cooking. That great cookbooks and great authority. She recommends actually not grinding it very much at all, keeping it as whole as it can. I like to have a little bit more of a medium grind myself. Depends on your particular taste and what you really want to take a look at. So something to pay attention to.
And maybe the reason they do that, she says that, is because maybe because it's so finely ground, it's kind of doing this, it's probably going to burn off a lot of the terpenes
Right.
because it's too fine.
Yeah. Just think about it this way: the higher the heat, the more terpenes and cannabinoids as well get burnt off. So that's why I tend to stand at about 350. It seems to be kind of the sweet spot for what's out there. So, Michael, we've covered a lot of questions. We've covered a lot of grounds. We've talked about a lot of things, from what is arthritis all the way through how to use it, how to cook it, and really that's there. I want to wrap up with this webinar, first of all, by thanking everyone. I know it's been a long webinar. We've been at this for an hour and 20 minutes. Thank you very much. We really appreciate you watching, and I hope that you got something out of this. If we can just help one person get their life back by watching this, we've accomplished what we want to do, and I hope that's you. That really helps you. That really that's out there. Our goal is to help you be able to understand and consistently use the product to really help you achieve what you want to be able to do. And again, with arthritis, I've seen patients whose hands have literally been locked together after 6, 8 weeks. Those hands open up, and the ladies are knitting, they're playing golf again, that type of thing. The other thing I find interesting is my mechanic was actually had arthritis that kept his hand open. And so by using medical cannabis, he was able to close his hand again, which if you think about it as a mechanic, it really helped him be able to start doing his job again. And I think that's something that really, really helps quite a bit. So Michael, thank you very much. Do you have any final thoughts for before we sign off?
No, I just want to thank you for having me today. I want to thank all the viewers for the questions. I enjoyed being here today.
Great. And I also want to point out that, again, next week we're going to be talking about cannabinoids, the week after cannabis treatments, your personalized cannabis treatments, and then cannabis use disorder. If you are looking for a cannabis um, consultant, the blunt joint, Manny Alfinas, he was supposed to be on the webinar tonight, but he has a family issue to deal with. He's somebody that can help quite a bit. He's very knowledgeable about medical cannabis, has worked in dispensaries, and does work with a number of different patients that are out there. If you're looking at getting a card, I recommend the Medical Marijuana Treatment Clinics of Florida. They have 22 clinics here in the state of Florida. They actually walk you through, not only help you get your card, but they walk you through the whole cannabis journey itself through emails, through videos, through call centers that you can call and get support and go from there. One of the things that bothers me about our system here in Florida is the doctor will give you a recommendation, meaning they'll put you into the cannabis registry, then they leave you on your own. And you're out there kind of floating and trying to figure out what to do. MMTC actually walks you through that, helps you figure out the products that are there, and can actually help point to the right products, formulas, and really usage techniques that are really important. And naturally, if you want just general information about cannabis, you look at our YouTube channel, the YouTube at Marijuana Aware. We have over 100 videos and a lot of different information that's out there that can help. Naturally, our webinar series is something that we do on Wednesday nights and can help quite a bit. We hope that we helped you get your life back and gave you some information that can help you have a better cannabis journey. Thank you, and join us next week. Have a nice weekend.